Hi everyone, this is the second part and lecture number 6 of my Health and Safety Management System series. In previous lecture, I introduced you to the Health and Safety Management System, what are the most popular health and safety management standards, and how they help us to establish, implement, and maintain an effective health and safety management system in the organization. In this lecture, I would teach you how does the health and safety management system work? What is a health and safety policy? And what are the three key parts that this policy consists of? What is the purpose of each of these parts? And who is responsible for signing the policy statement? How should the policy be tailored to fit the circumstances of the organization? And what role does the policy play in influencing decision making at all levels of the organization? Finally, why is it important to review and update the policy on a regular basis? Actually, an organization's occupational health and safety management system is implemented through its health and safety policy. The health and safety policy of an organization is an important document that sets out the organization's aims regarding health and safety, who is responsible for achieving these aims, and how the aims are to be achieved. Now, I'm going to explain you the definition of health and safety policy. Basically, it is a document that outlines an organization's general approach and commitment to achieving particular aims regarding health and safety and objectives related to the management of health and safety in that organization. Also, it provides a framework of general and specific health and safety responsibilities per staff. And it also provides guidance on the detailed operational arrangements to be made to protect employees and others from harm because of the workplace. So basically, the health and safety policy is aimed to achieve these three types, these three parts. One, basically, it outlines an organization's general approach, which shows that the management is committed to achieving objectives and targets in terms of their health and safety approach. Second one, it provides a framework for general and specific health and safety responsibilities. That means that the management assigns responsibilities to all the staff under their responsibility at each level according to their competence. And also, the organization has to make some arrangements to fulfill all the requirements of the policy. Now, coming on to the next part, that why legally it is important to have health and safety policy in an organization. It is very important part, and everyone should understand it well, because giving arguments in your favor when someone asks you, okay, gentlemen, tell us why it is important to have health and safety policy in any organization. Because the health and safety policy is basically the most important part of any health and safety management system. So we should know what are the legal logic behind it. So why it is important to have health and safety policy according to the law. In many countries, including the UK, it is a legal requirement for employers to have a written health and safety policy. For example, in Britain, this legal requirement is set out in the Health and Safety at Work Act 1974, Section 2(3). So, gentlemen, this is the main basic reasons that we have to write health and safety policy in our organization, because in many countries they have particular laws. And the most important law, which is international presence, has the International Labour Organization's Occupational Health and Safety Recommendation 1981, which is called R164. This is the another reason, legal reason for writing health and safety policy in your company if you want to manage health and safety related issues. It recommends that employers should set out their policy and arrangements in writing and bring this information to the notice of every worker in a language or medium the worker readily understands. So it's not only important to write understandable policy in your organization, but it should be done in such a way and be communicated to your all under commands or all your staff working under you, that you should provide this information to your under responsible people, that they should understand what you have written in that policy. Having a written health and safety policy can help organizations to demonstrate their commitment to health and safety and to comply with legal requirements. It also helps to ensure that everyone in the organization is aware of their responsibilities and know what is expected of them. So it will not only fulfill your legal requirements if your organization has health and safety policy present, but also it will help everyone to understand their roles and responsibilities in implementing health and safety management system. A health and safety policy A health and safety policy is usually presented in three parts, which are as follow. Number one is general statement of intent, statement of general policy, organization section, that is the second part, and then arrangement section, the part number three. I will explain each part one by one so that you people could understand everything clearly presented in every part. So let's talk to the first part of health and safety policy, that is general statement of intent or statement of general policy. So gentlemen, basically this section outlines the organization philosophy in relation to the management of health and safety. It sets out the importance that the organization places on health and safety and the commitment that can be expected. So, if your organization has health and safety policy, so their philosophy should be clearly visible through their written statement. This is what is expected from this part. It also sets aims and objectives for the organization to achieve. It is assigned by the person in overall control of the organization. The statement of intent may recognize some general aims that have to be achieved by the organizations, such as meeting legal obligations, provisions of a safe workplace, safe equipment, and safe system of work, as well as information, instruction, training, and supervision, risk assessments of all relevant workplace activities, performance monitoring, provision of the adequate resources such as experts, health and safety advice, and effective communication and consultation with workers. So first, we will write a statement of intent, which is basically the commitment and the philosophy and the thinking, general thinking approach of that management, that what importance they give to health and safety. So after that, after writing a good statement, we will set the objectives and targets. So first, I will explain you what are the objectives and targets. Then I will explain you that how these objectives and targets are set. Objectives and targets are basically components of health and safety management system. They should be specific, measurable, achievable, relevant, and time bound. And what are the targets? Targets are the specific steps that an organization takes to achieve its objective. They should also be SMART. That is specific, measurable, achievable, relevant, and time bound. Objectives and targets should be set at different levels or within different parts of the organization to achieve organizational goals. For example, senior management might set overall objectives for the organization, while individual departments or teams might set objectives that relate specifically to their work. Objectives and targets should be reviewed regularly to ensure that they remain relevant and effective. What possible objectives and targets might relate to? No, we will talk about this. For example, reducing accident rates, there may be one objective. Completing active monitoring activities, another objective, such as risk assessment may be objective. Delivering training to all workers may be your objectives in the health and safety policy. Developing a consultation process to engage the workforce, or achieving a better rate of performance than other similar organizations or the industry. So these are few examples where you can have set the objectives and targets for your company in your health and safety policy. When setting health and safety objectives, it is important to ensure that they are SMART. The acronym SMART refers to the idea that objectives should be specific, a clear, defined, precise objective should be there. Measurable. It is possible to measure achievement of or progress towards the targets, usually by quantifying the objective. Achievable. It can be done, it is possible. Reasonable. Within the time scale set and with the resources allocated. Time bound. A deadline and time scale is set for completion of the objectives. Here I explain you each and everything regarding objectives and targets through an example. The objectives improve the safety culture of the organization. For example, this is an objective. Is not SMART because it fails to meet many of the criteria of SMART objectives. It is not specific in that it does not identify a precise target to be achieved. It is not easily measurable, and it does not have a deadline for when success should be achieved. On the other hand, the objective review all 48 risk assessments within a 12-month period is a SMART objective. The target is precisely defined, a number is given that allows easy measurement of the success, and a time scale has been allocated. Now coming on to the part 2 of health and safety policy, that is organization section. What is organization section? This section highlights the roles and responsibilities that exist at all levels within the organization. It shows the lines of responsibilities and accountabilities. For example, it might state that the production manager is responsible for ensuring that all machinery is properly maintained and that employees are trained to use it safely. The organizational roles and responsibilities section of a health and safety policy deals with people and their operational duties in relation to health and safety. It outlines the chain of command for health and safety management and identifies the roles and responsibilities of staff to enable clear delegation of duties. These sections of the policy usually reflects the management hierarchy within the organization and allocates responsibilities accordingly. For example, the CEO or MD is ultimate responsible and accountable for the entire organization related to health and safety issues. It is common practice for this section to include an organizational chart showing the lines of responsibility and accountability in terms of health and safety management. This chart also shows the lines of communication and the feedback routes that exist within the organization for clear reporting. The chart may show line management responsibilities flowing down through the structure, functional responsibility that the health and safety manager has for providing advice at all levels of the organization, and the lines of communication and feedback up through the structure. Every nearly defining roles and responsibilities, the organization can ensure that everyone knows what is expected of them in terms of their health and safety responsibility, and that there is a clear chain of command for reporting incidents, hazards, and other health and safety issues. This can help to ensure that health and safety is taken seriously throughout the organization and that everyone is working together to create a safe and healthy workplace. Gentlemen, coming on to the part 3 of health and safety policy, that is called arrangement section. So what is arrangement section? What aim you achieve in this section? This section basically provides details on how the organization manages health and safety. It outlines the general arrangement that relate to health and safety management and the specific arrangements that relate to the individual health and safety topics and issues. For example, it might outline the general arrangements for carrying out risk assessments and the specific arrangements for ensuring the safety of the visitor to the workplace. The arrangement sections of a health and safety policy deals with the general arrangement that exist to manage health and safety and the specific arrangements that are necessary to deal with risks relevant to the organization and its activities. The systems and procedures used to manage health and safety are contained in this section. The general arrangements for health and safety management might include like the appointment of a competent person to oversee health and safety. This may be one arrangement. Another one may be the provision of training and information to employees, and the establishment of procedures for reporting accidents, incidents, and hazards. The provision of first aid facilities and equipment, the establishment of procedures for dealing with emergencies, the provision of the personal protective equipment where necessary, the establishment of procedures for monitoring and reviewing health and safety performance. So these are some examples that there must be some arrangement about these topics. There may be some specific arrangement as well for dealing with specific risks, which are as procedure for working at height. The procedure working at height is a serious and risky process, so it should have a specific procedure. So in arrangement sections, you can develop or establish a good procedure, safer procedure for working at height, procedure for working with hazardous substances, procedure for manual handling, procedure for working with machinery, and procedures for working in confined space. So these are the few examples. You can set arrangements. Your organization will make the arrangements for health and safety. The arrangement section of the policy should be comprehensive and cover all aspects of health and safety management within the organization. It should be regularly reviewed and updated to ensure that it remains relevant and effective. Now, coming on to the last part or the last section of health and safety policy, that is review. So, gentlemen, review is very much important. Why? The policy should be updated and reviewed regularly. A health and safety policy should not be considered as rigid and unchanging. Instead, It should be subject to regular reviews so that it remains current and relevant. In this way, it can be considered a live document. It is good practice to review the policy on a regular basis, for example, annually. However, there are other circumstances which could give rise to reviews, such as technological changes, organizational changes, or legal changes may warrant you to review your health and safety policy. The aim of the review is to make sure that the policy is up to date and accurate. The date of the last review should be recorded in policy documents to indicate how current they are. When reviewing the policy, it is important to consider whether it is still relevant to the organization and its activities. This might involve looking at changes to the organization structure, processes, or activities, as well as changes to the legal or regulatory environment. The review should also consider whether the policy is being effectively implemented and whether it is achieving its objective. This might involve looking at accident and incident data, as well as feedback from employees and other stakeholders. Based on the findings of the review, the policy may need to be updated or revised. This might involve making changes to the general arrangements or specific arrangements, as well as updating the roles and responsibilities section of the policy. The review process is an important part of ensuring that the health and safety policy remains effective and relevant, and that the organization can create a safe and healthy workplace for its employees. So, gentlemen, here comes the end of this lecture number 6. I hope you have understood the health and safety policy and how it works and what are its parts. And I have explained you each part with detailed explanation. In start, I also mentioned that it is the most important part of your management system. If your company has a good and effective health and safety policy, this means their management system is very effective. And through this management system, which is your main control for your all health and safety activities which are being done in your organization, through this health and safety policy, you can control your management system. And through your management system, with an effective health and safety management system, you can control all the health and safety related activities in your organization successfully. This means that if you understand how to manage and coordinate different health and safety processes, different health and safety activities, then you will be able to create and establish a successful management system.